The general idea for this program began with the experience, the observations from the American College of Surgeons trauma program, which has been in place for several decades. And it's been clear, it's been well documented and published that has resulted in improved outcomes for patients and their families. And so with that background, we felt that children were a key part of the constituency, certainly that we as pediatric surgeons deal with, but all children's surgeons. And so we set out to try to use the same framework, and to create standards. So the standards is in the first version related to particularly having the right resources at the bedside, having the right people with pediatric specific background training experience, really at all levels, not just as the surgeons, but in terms of anesthesia and critical care and imaging and nursing and so forth. So it for the first time really put in place standards that were either evidence-based or consensus-based about what the team should look like.
The purpose of the revision was to incorporate all of the lessons that we've learned from the 35 plus sites that have already been participating in the children's surgery verification program. So really what we did was take the lessons we learned from that and try to incorporate them into consolidated standards. I think if I were going to come up with broad categories of what we're trying to accomplish in those revisions, I think the first was, one of our goals was to be more inclusive. In the first part of the program, we did identify some hurdles for hospitals that were not university-based and potentially hurdles for level 2 centers. And we really focused on trying to take down those barriers as long as they didn't in any way impact the quality of care.
The specific thing that I would point out is that the processes, the structures that are in place include the hospital administration representatives. So we have people from the C-suites there, people who are in a position to commit new resources, whether that's new people or dollars or other kinds of things. And so they hear the problems in a real time on a regular basis that they didn't before, and they hear it from the people at the bedside. And it brings a perspective and an understanding that I don't think was routine before.